So thank you, doctor. And what is CKD, chronic kidney diseases? How we can assess the function of kidneys? What are the stages of CKD, doctor?
What is CKD means? Any kidney damage, if it is present for more than 3 months, whether it is in the structure or in the function of the kidney, which decreases GFR, that is, it decreases the function of the kidney. It may be identified by due to tests or by images by taking an ultrasound or an X-ray and all, or by looking at the blood or urine, any abnormalities in imaging. If it is present more than 3 months, it's called chronic kidney disease. It may be due to various diseases, but when they are lost for more than 3 months, these um, symptoms is called chronic kidney disease. And the kidney function, major function, is measured in terms of GFR. That's called glomerular filtration rate. When the GFR is less than 60 ml per minute, it is called CKD. Normally, the GFR is measured by what's called creatinine clearance, shortly called as CCR. There are very many formulas are there. And now we easily measure by a test called EGFR. It is a estimated glomerular filtration rate. That's a short expanded name of GFR. And that is every lab we tell them to do that because it is not a special test, it's a calculation that tells us the amount of kidney function the patient has. The normal GFR is from 90 to 120 ml per minute. And according to the fall in the GFR, the chronic kidney disease stage from 1 to 5 according to GFR. And early detection of kidney disease is possible even before the GFR fall by a simple lab test by doing urea, creatinine, and urine protein. If your urine has any protein in the urine, that is albumin, or if your urea and creatinine are increased, that means you have a kidney disease. A simple test. Very often kidney disease are silent, and if it is done routinely, we'll be able to identify the kidney disease very early. What's a kidney failure is when the GFR, that's the glomerular filtration rate, falls below 15 ml per minute. Normally it is 90 to 120. If it falls below 15 ml, that's called kidney failure. That's a stage you have to replace the kidney function either by dialysis or transplantation. When these two are not possible, now we have started what is called a palliative care or supportive care for these patients. This is a chronic kidney disease. And I told you about the stages of kidney disease. That is according to the GFR. If it is between 90 and 120, it is called kidney stage 1. Kidney damage may be there, but the kidney function is normal. There may not be any symptoms. It's very early. But it has started as, if you look at the urine, it may show a protein. But the kidney function is normal. If it is 60 and 90, it is called stage 2. The kidney damage is there, but there may be a slight indication for the kidney disease like proteinuria, raise in urea, creatinine. Stage 3 is 30 to 50, 59, and that has they start presenting with all the problems of kidney disease I will describe right now. And stage 4 is between 15 and 30, 29. The pakka kidney disease problems will be there, whatever may be the case. And stage 5 is what is called end stage renal failure. That is the time you have to go for either dialysis or transplantation. That is the stage called stage 5 or end stage renal failure. Next. So if you look at how many people are suffering from kidney disease, chronic kidney disease, I'm not talking about other diseases. There's 19 million Americans have kidney disease, and of them, 435,000 have end stage renal failure. That is end of stage 5 renal failure. And the mortality, that means death rate amongst this group is 24%. In India, chronic kidney disease, there is a project called Seek India, which assesses the number of, it's not very accurate because many of us don't report the disease. It's about 17.2% of the population seem to be having chronic kidney disease. Globally, it is around 8 to 10% of the population. 1% of this population go into CKD, go into ESRD, that is called end stage renal disease. And only 10% of this group, this ESRD people in India are able to get dialysis or transplantation. And right now we have about 4 to 4 lakhs of people needing dialysis in our country. This is the estimate of uh, renal failure in our country. Next, renal disease. So what are the common causes of the chronic kidney disease? As I said earlier, when I started my study in nephrology, it used to be glomerulonephritis. But now, nearly 30 years after my primary education in nephrology, the diabetes has taken over in producing renal damage. 39% of patients of CKD, chronic kidney disease, are due to diabetes. Next is hypertension, blood pressure, high blood pressure. At 28% of chronic kidney disease is due to hypertension, high blood pressure. Only 13% uh, due to the primary glomerulonephritis. I described so many diseases. And congenital, people born with, I told you about earlier, about the cystic and congenital renal disease forms 4%. Another group of nephritis called interstitial nephritis or infective nephritis is 4%, and tumors and neoplasm are due to 2%. But remember, the major cause of chronic kidney disease in our country is diabetes and high blood pressure. Next.
Thank you, doctor. What are the common causes and symptoms, and how to identify the kidney problem ahead of time?
I just now told you about the causes. So people with diabetes, high blood pressure must have, and after age of 40 or 45, when you have more than 5 years of diabetes or hypertension, you need to have a routine checkup. It may not have any symptoms. But once symptoms occur, the kidney damage is little severe, probably CKD 3 or so. The common symptoms are swelling of the legs. The swelling of the legs not permanent. Initially, it will start when you travel, when you sit long, because the computer guys sit at the table for more than 12 to 16 hours. Morning they'll go well, but evening the shoe will be tightened. They will be finding it difficult to remove the sock. The edema, that's called edema, water retention in the body. Or your face may be puffed up in the morning. That is one of the early symptoms. And tiredness and malaise. That is, you feel very tired and you are not able to do your normal work as usually. And third is a decrease in the urine output, which you may not notice. Very many people tell me that, no, I pass urine 3, 4 times or 2 times at night. But they may not know the quantity of the urine passed is less. We call it oliguria. We pass, as I told you, 1,500 to 1,800 ml of urine per day. And this may be less, but you may pass urine 4 or 5 times. Another symptom is nocturia. Nighttime, most of the younger people below 45 or so won't pass urine. Once they go to bed, they will get up in the morning and pass urine. But once kidney disease occurs, many of them start nocturne, night urination, and that is one of the symptoms. But not every winter, when you have AC and all that, you may get up in the night and pass urine. But one of the early symptoms are, now we call it nocturia. And number two is gastrointestinal abdomen. Appetite may be less. We call it anorexia. Appetite may go down, and nausea and vomiting. Patient, you don't have a desire to eat, you feel like nauseated, you feel vomiting, and this way you don't feel like eating. That is another symptom. And skin may have itching, and you may become pale because you have become anemic. And eyes, if it is a diabetic patient, if you develop kidney problem, your eyes also will be affected. We call it diabetic retinopathy, and your vision may be affected. And cardiac problem, kidney disease is one of the common cause of heart cardiac problem. Most of our kidney patients don't die of kidney failure, but they die of cardiac problem. One is the hypertension, the blood pressure may be the kidney may be the cause for the high blood pressure. They may lead to heart failure, coronary artery disease, that is heart attacks, ischemic heart disease, pericarditis, etc. And when it's advanced renal failure, patient may develop convulsion, fits, seizures, and other neurological problems. So these are some of the symptoms. They are not early symptom is developing uh, leg edema or facial swelling and tiredness and your BP start going up and loss of appetite, etc. But so many symptoms may occur after when the kidney disease advances. Next.
Yes.
So one thing you have to remember, kidney diseases are common. They are not uncommon because unless we look for it, when we start looking for it, you will know understand the commonness of it. It is harmful because very often if you don't identify, if you don't treat, it leads to ESRD, that is end stage renal failure, premature death, coronary heart disease, strokes, and may lead to renal replacement therapy. But one thing you also understand that it is treatable. If you treat it early, you can, it's not treatable, not completely may not be curable, but very often treatable. Early detection, appropriate management, following diet restriction, regular follow-up, and other conservative treatment retard the progress of the disease from stage 1 or 2 to stage 5. And very sometimes you may get a complete cure. Very few kidney diseases you may get a complete cure. And fourthly, if you avoid unnecessary medications, it is very easily you can arrest the progression, particularly like alternative medicines, native medicines, and Siddha, Ayurveda, and all those kinds of the medicine. We do not know how do they act. We know allopathic medicine, sorry, they are harmful to the kidney and we tell the patients. But we do not know about the other group of medicines, how whether they are harmful to the kidney. But very often we find people taking Siddha, Ayurveda, homeopathy, and etc. coming with kidney diseases. So you better avoid unnecessary, unknown medications. Next. So, certain important facts to remember, early stages of CKD has no signs and symptoms. Unless you start screening the patient, looking for the regular medication, a simple test like urine test or blood urea creatinine will identify the early stage of CKD. And CKD is not usually reversible. You can't become a diseased kidney of stage 3 or 4, cannot be to normal. But that you have to remember, it may be a hard fact, but you have to understand that. And so start early treatment. What does the regular treatment does is it slows the progress. It slows the progress from stage 1 to stage 5. It may take 20 years sometimes to reach if you don't, if you take care to reach a stage 5. That's good enough. But if you don't take, if you are very careless, if you don't take your treatment properly, it may be in 5 years. So that remember that it can slow the progress and sometimes arrest the progress of the disease. It stops at stage 3 itself. So this is another important factor to remember. If you allow the chronic kidney disease, CKD, to progress, it ends in end stage renal failure.